Unknown causes was the leading cause of death in Alberta last year. That category leads the way over dementia, which has been in the top spot since 2016, and COVID-19, which began adding to the province's death tally in a big way in 2020.
I think it's probably multifactorial, so there's probably many things playing to that.
The number of deaths with unknown causes has gone up over the last 3 years, starting in the 500s in 2019, rising to over 1,400 in 2020, and doubling to more than 3,300 in 2021. Before that, the category didn't even rank. Dr. Daniel Gregson believes lack of resources, delayed access to healthcare services, and post-COVID complications have contributed to the increase.
We have this impression of, surviving COVID, and that's the end of it. And that's not necessarily true.
Gregson points to a larger study out of the U.S. that found people who had COVID-19 are at a higher risk of heart disease, stroke, pulmonary embolisms, and death compared to those who haven't been infected. The risk is even higher for those who end up in hospital or in the ICU with COVID.
One would expect that some of those patients are going to, survive the COVID and then die at home from other complications.
Alberta Health and the Medical Examiner's Office said they are looking into the dramatic increase, but have yet to provide an explanation for the unexplained deaths. Dementia was the second leading cause of death in Alberta in 2021. COVID-19 took the third spot, up from the sixth spot in 2020.
I think that fact that number is not on top spot is essentially a medical miracle in us being able to get out vaccines in less than 18 months to the average person in Canada.
Gregson warns that while vaccines lower the risk of death, it is still important for people to be vigilant. Nicole DiDonato, CTV News, Calgary.